Well, concussions, they can be pretty serious. Over 3 million of them happen in the United States each year.
We often think about sports, but that's not always the case. And concussions can lead to other physical problems as well. And that's what happened to our guest, Derek Berg.
It did, and he's joining us today to share his story along with Dr. Drew Drummond, who treated him at the Spinal Balance Health Center. Gentlemen, good to see you guys.
Welcome.
Good morning.
Thanks for coming in. So, Dr. Drummond, let's start with you, and then we'll get to Derek's story. But concussions, it's been a big topic relating to football and other athletic activities as well. Yeah. So I guess, what are your thoughts on this? And I guess who's most at risk?
It's become a big deal because now our athletes are so much bigger and faster and stronger, and they're more aggressive on the field than they were 30 years ago. So a ton more athletic injuries, like you said, football, wrestling, soccer is a big one. But also, I think with all the cell phone usage, we're seeing more car accidents. Yeah. And the whiplash accidents and the head trauma. And then also the classic one is falling off of a high place, falling off ladders, things of that nature. So anybody that's had an impact where they've been accelerated rapidly or decelerated rapidly is going to be at risk. But I think really we know more about it now because of the press coverage. It's getting a lot of publicity.
Sure.
Yeah.
Well, and Derek, you're joining us today. You had a concussion a little over a year ago. Can you briefly just tell us how it happened, and then what happened after that? What happened next?
Well, I had an accident. Was involved in a bike accident. And hit my head pretty hard, and I woke up, had a really bad headache, nausea, went to go see a general doctor. They gave me an MRI, said my MRI was clean. I followed up with a bunch of neurologists, and they kept saying it's going to get better, it's going to take time. Saw 3 neurologists, about 4 or 5 general doctors, family doctors, and a year later, it's still having the symptoms.
Yeah, no one really seemed concerned. Then.
Yeah,
they just
So they kept saying they said they diagnosed me with post-concussion syndrome, and had gone to therapy, speech, physical therapy, occupational therapy, vision therapy, but was still having the lingering symptoms, the headaches, the dizziness.
So you have this incident, you hit your head, and for over a year now you've been trying to find some relief. You've seen all these specialists. How'd you hook up with this guy, Dr. Drummond? and then what were the results? Like what type of results did you see from his care?
Actually, my girlfriend, she had referenced me. I saw, and I did my research, saw athletes like Sidney Crosby, who actually saw a chiropractor. He had kind of the same thing I had, that was going over a year from a concussion. He found relief from chiropractor, and that's how that happened.
And Dr. Drummond, how exactly were you able to help Derek?
Well, with concussions, usually people think of the brain hitting the inside of the skull and causing the bruising, and then metabolic problems in the brain. But that's not the only thing involved in concussions. There's also cervicogenic or neck problems that will cause post-concussion disorder. So what happens to an accident or injury, you can see here on the left is what a head and neck should look like. The top bone of the neck should be kind of horizontal so everything's in line. And through accidents and injuries, the same kind of accident or injury that can cause a concussion where the brain is injured, it can cause a misalignment to the top of the neck. And very small misalignments at the top of the neck can then lead into the nerve interference at the top of the neck that lead into dizziness, headaches. Some people complain of just feeling detached from their head, fatigue, brain fog is very, very common. But if people are just looking at the brain injury and treating just the brain injury, and that honestly is what most doctors are trained to do. You look at the brain, you see if there's a problem, and if there's still symptoms, you just kind of wait and see what happens. But if there's an atlas misalignment, it'll just sit there and it'll keep causing the same kind of neural problems over and over and over again. But if you can correct that problem, and honestly, I think the upper cervical problem is more common than the concussion where there's the brain trauma. So if that's not addressed, it just keeps going.
Was there anything unique about Derek's case, or was it a fairly common concussion?
No, if he wouldn't have told me about the concussion, it wouldn't have made a difference to me. We get a lot of the people that come into our office are back pain patients, neck pain patients, and we'll correct their atlas because the atlas misalignment leads into posture problems. And once we straighten them up, they may have all the same post-concussion type symptoms as he did and don't know why they didn't have a concussion. It was all because of the misalignment. They just go away. It was the same with him. I didn't treat him as a concussion patient. I treated him as someone with an atlas misalignment, and then the symptoms resolved, and I think very rapidly.
Well, how you feeling?
Yeah.
Derek?
So would you recommend this for someone else?
Absolutely.
Yeah.
It was. It's been a blessing. I've been looking the whole year, and the doctors kept saying, "Take time. It takes time. It takes time. Just patience, patience."
But not a year. I mean, yeah.
No, it was too long, and I'm glad I found Dr. Drew.
Well, and how long did you say that you've been getting treated by him, or when did you start that?
About 2 weeks now.
Yeah, the
2 weeks, you're
headaches,
already seeing
everything.
relief,
Feel
yeah.
you can.
Yeah, the first day.
Right.
I woke up at like 3 in the morning, and I was like, I feel great. Headache's gone. I can.
Well, after
the
a year of
fogginess
living that way, right?
is gone. I was so excited. I called family members. I was like, I think I'm better now.
Good. And you've been looking at this graphic on the screen. It's a special offer. The first 15 people who call Dr. Drummond's office are going to receive a consultation, exam, and x-rays, all for $50. SpinalBalanceHC.com.